Well, that's it for Metro News, Sports, and Weather. I'm Bob Renison. Coming up on the rest of Kansas City Alive, Dr. Buford Casebolt will be here with Dentistry and You, and tonight he'll focus on children's dentistry. The phone lines will be open, so get your questions ready.
Hello, welcome to Dentistry and You. I'm your host, Dr. Casebolt. Tonight I want to talk about something very important, children's dentistry. Now, it happens to be the month of February, and February is National Children's Dental Health Month. Of course, I think that every month is a good month to talk about children's dentistry, but we'll talk about it very sincerely tonight because it's very important. And I'd like to remind all of you out there, this is a call-in segment. If you have a question about children's dentistry, if you're a parent, if you are a grandparent and you have little grandchildren, if you are an aunt or an uncle and you have a niece or a nephew, give me a call. I'd love to talk with you. One of the most often asked questions that I get about children's dentistry is, when should I bring my child in for dental care? Well, anytime's a good time. I always suggest that they should come in with their parent at an early age of 2 years old, 2 years of age. They can come in, become familiar with the dental surroundings. Remember, a dental office is a rather unusual place. It's not like being at home. There's a lot of big equipment. There's a lot of unusual sounds. There's a lot of people walking and running around and doing things. A child can become very accustomed and very comfortable with the dental office if they come in at an early time when their parents come in for their dental appointment. Let their teeth be looked at. It's great. Children really love to do this. They like to open wide and have the doctor look in there, peer in, and say, "Ooh, what a nice set of teeth you got." And it's a good time for the dentist to talk to the parents about what the parents need to do to foster good dental health. And that leads me to the next question that's often asked. What should I do to help my child take care of their teeth at home? Well, first of all, when a child gets teeth, and that's usually within about the first year of life, and keep in mind, every child's a little bit different. No one child is the same. So don't get too worried if a year goes by and no teeth are present. Then again, in some cases, some children are born with teeth. Every child is different, so don't be too worried about that. As soon as they have teeth, they need to be brushed. At 1 year of age, you can start with a very, very small toothbrush, and there are a lot of good ones on the market. Remember, those little teeth require little toothbrushes, and always make sure that they have one toothbrush that is their toothbrush and the one that they like to use. Just have to put a little bit of toothpaste on it. That's all that's necessary. Just a little drop for those little ones. And help them brush. A child doesn't come into the world knowing how to brush their teeth. You have to help them. You have to show them. And when you brush your teeth at night, let your child see you brush. They like to imitate their parents. When they see their parents brush, they're going to want to brush. And that's a great thing because that fosters good dental health with our children. And again, I want to remind all of you out there, if you have a question about children's dentistry, any question, I'd love to hear from you. And I'd also like to mention the answers that I give you to your questions are, in my opinion, I am a registered dentist in Kansas and in Missouri. And I feel very confident about answering your questions. But remember, these questions are, in my opinion, at my professional discretion. So I'd like to mention that as a disclaimer. Another question that I often get, a parent will ask, my child is 2 years of age, he's 3 years of age, and he hasn't gotten all of his baby teeth yet. Or better yet, my child is 6 or 7 years of age, and he or she has not gotten their permanent teeth yet. Well, I always answer that question more or less, don't worry about it too much. Every child is a little bit different. But there is a guide for the eruption pattern of permanent teeth. First of all, by the age of 2, a child should, I say should, have all of their baby teeth. There is some variability to it, but by age 2 they should. Not until a child is 6 to 7 years of age do they start seeing a big change in the mouth. The child is growing a lot by then. There's been a lot of changes. Their jaws are growing. Their permanent teeth that have, by the way, been in place in their jaw since a very early age of 1 year are just now getting to the developmental point where they want to come in and replace some of the baby teeth. Now I have a couple of models that I'll show you. We'll start with this one here. Now this model is of the lower teeth, a child's lower teeth. And if you look here, you see the baby teeth here. Now, in most cases, the very first teeth to be replaced are the lower central incisors, these teeth here. These are referred to teeth O and tooth P. They are generally the very first teeth to be replaced, and about from age 5 to age 6 are the ages that we'll see these teeth replaced. They'll get a little loose. The child might complain that, gee, Mom, my teeth don't feel right. They kind of hurt. And when I bite down, they wiggle around and move around. You might even notice a little bit of bleeding. That's not unusual. Remember, there are permanent teeth down in the gums here, down in the bone, down below here, and they're pushing their way up. Eventually, tooth O and P are lost. And within a short period of time, you can see the permanent teeth begin to push their way up. This is the normal eruption sequence. Now, I'll bring the other cast up here. This is the upper cast. These are the child's upper teeth right here. Now, we'll put them together here so you can see them as a set. The next set of teeth to erupt properly, let me get them aligned properly. Now, that's much better. The next set of teeth are the upper central incisors, tooth E and tooth F. Baby teeth are listed in alphabetical order, whereas permanent teeth are listed from tooth 1 to tooth 32 by numerical order. Tooth E and tooth F are the next teeth to be lost and replaced with tooth 8 and tooth 9, the central incisors. This happens shortly after the lower central incisors are lost. It doesn't take very long to start seeing this sequence. From about age 6 to 7 to age 8, almost all of the upper and lower incisors, that includes the lateral, the two centrals, the lateral over here, and of course the lower lateral and central incisors eventually become loose, they fall out, and as we say in dentistry, they're exfoliated in favor of the permanent teeth. Now, this goes on for a period of time. Now, it's interesting to note, about age 6, another interesting thing happens. The patient's, the child's 6-year molars start to come in place. Now, 6-year molars are permanent teeth. They are non-succedaneous teeth. Now, what does that mean? That means that they came in not replacing permanent teeth. Now, you might notice in your child's mouth if you look in with a flashlight, and I suggest you do that. It's an interesting experience both for yourself and your child because you get in tune with their mouth. You know what's going on. And you should look from time to time. It's always a good idea. At about age 6, you'll notice 2 bumped out or swollen out areas back behind the second baby tooth molars. Now, we'll look back on our cast here so that you can see. I'll use the upper cast here and I'll turn it over. These are the baby teeth here. The 1st or 6-year molars come in these areas right here. And you'll notice little bumped up areas. Sometimes if you reach in the mouth and you press on those areas, you might even get a little bleeding there. That means that those permanent teeth are beginning to erupt into place. And this is normal. Age 6 to 7 is a very normal time for this to happen. Now, another thing that's interesting happens in the eruption sequence. We are pushing through the ages now to age 6, 7, and 8, and even to age 9. Some other interesting things begin to happen. The primary first, here's a first molar over here, and primary second molars begin to erupt into place. That is the next process. And there is a long range of time, anywhere from age 10 to 11 to 12. These teeth could begin to erupt. Now, this is an interesting time because the chewing teeth, the teeth that are responsible for chewing heavy foods, become loose. And sometimes a child will complain of discomfort. Now, at this time, it is important to note that they're getting their premolar teeth, and that's very important because these premolar teeth are the replacement for those molars, those primary molars, and that's very, very important. And I understand that we have a caller on the line. Please, go ahead. You're on the air.
Yeah, my son.
Yes, you're on.
Yeah, I've got my son here, and he's got a blue spot on his tooth.
Yes.
It's like over the tooth. I don't think the tooth is coming out.
How old is your son?
6.
He's 6 years old. Is it in the center of the tooth?
Yeah, kind of. It's on top of it, like.
Okay. Is this a back tooth or a front tooth?
In the back.
It's in the back. Okay. Is it on the surface where he'd ordinarily chew?
Yeah.
Okay.
Yeah, it's covering it, like it's on the side.
Okay. Has your child seen a dentist yet?
No. I should take him in.
I think that's an excellent idea. You know, do you have an opportunity?
Do you know what it is?
Well, do you have an opportunity to go to a dentist yourself?
No.
Well, you know, one of the best things that I recommend, in fact, I was going to get to this question in a minute, you should always take your child in when you go. That way, especially at their first visit, it's real important because they see that daddy's getting his teeth examined and he's having a good time. And he knows, hey, if daddy's going through it, it must be okay. And that's always the way I recommend those first visits for your child. Now, I can't be sure, to answer your specific question, I can't be sure whether that's an area of decay or exactly what's going on. Sometimes the central part of teeth can become stained with just everyday foods. And the little grooves that are on the top of the teeth, where the teeth do the chewing, the back teeth do the chewing, sometimes are so fine, it's very, very difficult to clean those out with just normal toothbrushing. Now, I can actually show you on a model some of these fine grooved areas. They're so fine, there's just no way that a toothbrush can effectively get in there. And that brings me to another point. A lot of times, because of that very fact that they're hard to clean in these areas, decay can work its way into these areas, and the tooth will decay. And that might, I'm saying that might be the issue here with your son's tooth. I would recommend that you have him go in for a routine dental checkup and have those teeth checked out thoroughly. If it is a small cavity, a lot of times a very, very simple process can be instigated where the teeth are just cleaned out slightly and a little bonding agent can be placed on. It's very comfortable, it's a very easy procedure to do, and it's very non-traumatic, and it makes those first visits for your child very positive and good visits.
Could you recommend a place where I could go?
Well, generally what I recommend is that you ask a friend who they take their children to. That's one of the best recommendations. If their children like their dentist, then that's a good bet. You should go and call that dentist, get the phone number from your friend, or if they just have their name, look them up in the white pages. They're generally listed there. And for gosh sakes, make an appointment, get in there, and have your child's teeth looked at.
Okay, thanks.
Thank you, and thanks for calling me. We have another phone caller. Please go ahead. You're on the air.
Yes, my question is, what's the best way to teach a child to brush regularly, to get him in the habit?
That's an excellent question. The best way is see and do. If they see their parent brushing their teeth, they know it's a good thing to do. Children really mimic their parents, and that's a wonderful thing. I have 2 children myself, and I always draw attention to the fact that, hey, daddy's in there brushing his teeth and he knows it's important, so you need to get in there and do the same thing. That does bring me to another issue also. Sometimes children don't do a real thorough job, and you have to lend a helping hand. You need to get in there, use your hand, help guide their hand with that toothbrush. And remember, they need to have their own personalized toothbrushes. The ones, you can even put their little names on it if they like, if you have more than one child. Remember, it's important that they know where that toothbrush is, it's their toothbrush, and that they have a responsibility every night before going to bed to make sure that their teeth are clean. And again, it doesn't take very much to get your children in the habit of doing that. And that's a real important thing, because once they're in the habit of doing that, they're used to doing it. And that follows through with them for a lifetime. And I think that's a real important point. Did I answer your question?
Brushing.
Yes. Please go ahead.
What is the earliest age you would recommend getting your child to start brushing?
As soon as they have teeth. And this could be at most any time from age 6 months to a year on through life. And the sooner they get used to it, the better they are.
Okay. Well, thank you very much.
And thanks for calling.
Bye-bye.
You know, I was going to touch on the issue of children's toothbrushing. You know, it is very important to have a toothbrush that's designed for children. I have several toothbrushes here just to give you an idea of the difference in size. Now, the one on the right of your screen is a toothbrush for adults. That is a typically sized toothbrush. It works very well for adults, but in our children's mouths, it doesn't work out very well because those mouths are kind of small. Now, I'll bring this one closer. You can see how much smaller the orange toothbrush is. This one is specifically designed for children's teeth. As a matter of fact, this is my son's toothbrush, and I have to get it back to him tonight, so I'll have one to brush with. But I thought it was a good example, so I brought it with me. Again, a child's toothbrush should be small and should conform very nicely to those baby teeth. And I'll actually show you. I'll bring the model over here. Children's teeth have an interesting advantage over adult teeth. They are smaller and they're easier to clean. And that's a good thing. Adult teeth are larger and have more surface area between them, and that makes them more difficult to clean. That's why adults have to use dental floss. Now, when children brush, it's important that they be thorough. It's really easy to give them a lick and a promise. Go over the front ones real quick, spit out, and that's it. Well, that's not thorough cleaning. Children need to know to be thorough. They need to take that toothbrush and reach back to those back areas with a little pressure and motion like this. They don't need to scrub the teeth, but they need to get all the surfaces and all the areas thoroughly. And they need to come back around here and get the areas also. Again, it's really important to be thorough. And again, as I said before, if you lend that helping hand, you can be sure that they're doing a thorough job, because you as the parent of your child have that responsibility to make sure. It's easy to miss areas, especially those back teeth. And one other thing, and this is important. I would never tell a parent that they should deprive their children of sweets. At least hardly ever. I think candy bars, candy, things of this sort, they kind of go hand in hand with children. I know I have a sweet tooth and I haven't given up candy, but I know, and I tell my children, if you eat sugary and sweet foods, you fuel the bacteria. You provide them with a nutrient. And once the bacteria have the necessary nutrients, they reproduce, they produce plaque. Plaque burns the teeth and causes tooth decay. It burns the gums and causes gingivitis. And this is a very bad thing. And this is why it's so very important if your child does eat sweets. And for that matter, I would include potato chips, corn chips, even baked potatoes, French fries, the bread on a hamburger bun. These are carbohydrate type materials. They can be just as bad as the sugars in sugary and starchy foods and candy bars and things like this. It's very important that they know when they eat foods like this, they have to pay a small price. They have to go brush their teeth. And that's real important, because that removes the nutrients, the bacteria don't have a chance to get onto the teeth, produce plaque, and cause the burning tooth decay sensation. And I would say that to all people out there. Make sure that your children brush. Now, a good question also, how often should you change toothbrushes? Well, when they wear out. The toothbrushes I showed you were relatively new and they're in good shape. But you know, toothbrushes last a very long time. You know, I've noticed when toothbrushes are used over and over, they get kind of brittle or hard. I prefer soft bristle toothbrushes. I would say if the toothbrushes are getting pretty mangled, the bristles are all going in whichever direction, maybe that's a good time to change toothbrushes. They don't cost very much. What the heck? You'll spend more money on toothpaste itself. And one last point I'd like to make, fluoride rinses. I personally don't think they're that important. Fluoride is in the drinking water. It's in the toothpaste we use. Sometimes small children eat the toothpaste. That's why you shouldn't use a whole lot. What is important is that they remove plaque from their teeth and they get the necessary trace amounts of fluoride from the drinking water and the toothpaste. And that is very, very important. Again, make those first impressions of dentistry on your children very positive ones. Talk it up, be positive. It's very, very important. Your children's teeth are counting on you. and you're counting on your children. They are the future of our world. And with that, I want to thank you very much for watching my segment, Dentistry and You. Now, don't touch that dial, because when we come back, we'll find out what's on the next Kansas City Alive.
Here's tonight's primetime lineup on KCCP TV.